Hello, welcome back once again in the part two of this health needs assessment course. So we're going to go straight to practicals. So let's see an example of health needs assessment. So I want to acknowledge and thank my classmates and my classmate Kemi for being willing to give me her essay because I lost my essay. I was not able to retrieve it from the portal. So I had to find an alternative to demonstrate what the essay for HNA, what that's Health Needs Assessment, looks like. So she has not given me the permission to share this essay, but at least you can watch it in this video, and then I'm going to explain some key things using this essay as an example. All right. So the first thing is to write your introduction. So this essay is around American Indian and Alaska Native veterans. All right. So, and the focus is on mental health needs assessment. All right. So your own essay can be sexual health needs assessment of adolescents in Bradford, adolescents in the UK. All right. Adolescents in Bradford, or it can be health needs assessment of children with type 1 diabetes. It can also be health needs assessment of adults with dementia in England or in the UK. So it all depends. All right. So now I'm not going to go straight to the introduction of this essay. I'm going to go straight to um, the keywords. So here, US means United States of America. MH means mental health. Okay. Then NV means native veterans. Okay. Then AIAN means American Indian and Alaska Native. So those are the main things you need to know about this essay. Then let's go straight to where I want you to see. So I want you to see how she introduced the approaches to health this assessment. All right. So here she said, according to Guilford and Jessup, there are three approaches to conducting health assessments. All right. Now look at this. The epidemiological approach draws strength from estimates of clinical findings and systematic reviews of previous study. Now, this is where what I was saying. You must critique your approach. So you can see this is how she put it here. So its limitation is what in its inability to quantify what unexpressed needs. Inability to quantify unexpressed needs, especially those who may not access services. All right. Now, the next one is what? The corporate approach. Remember, the whole essay is not for you to start to critically analyze the approaches. So, but you just have to mention it, all right, in a paragraph. So, the corporate approach demands different perspectives. Now, this is the critique. Why deeming the decision between need and demand, it is weakened by its tendency to overlook the knowledge of interest. So that is the critique. So being able to add a critique, that is what makes you uh that's what makes your essay critical. All right. So how do you get this kind of critiques? Just type it in Google. You can say critique of corporate approach to health needs assessment. You will see it in Google or in Google Scholar. Just add the word critique. to it, all right, or disadvantages and advantages of corporate approach. You will see a couple of articles, right? Now, this is for comparative approach. So, comparative approach compares services received by two populations while considering the demography and socioeconomic differences. Now, this is a quote then. Now, then she didn't critique this one, but then the last one is what? Evidence-based approach. Now, look at the critique. The strength of this approach is what it can be used when because of time constraints. All right. So, in this essay, however, she used a participatory community-based methodology combining epidemiological, evidence-based, and corporate approaches. So, this is an approach that I didn't mention in the first video. All right. So this combines all the different approaches. So if you want to use this, maybe for your presentation, then this is also good. Now, he said the comparative approach is de-emphasized due to limitation on the quality of the data to the reference population. So this is her own critique for the reason for what choosing a combined approach, okay, which is participatory in nature. Now, the things I'm looking at for if I'm to mark this, I'm looking at for what the periods. How long is this project? Are there are there considerations for resources? All right. Then I didn't say this in my video. I want to see the legal backing. I want to see the legal backing for health assessment. So, for example, in the UK, you have the Health and Care Social Act. So, this is a Public Health England document, okay? Health and Justice Health Needs Assessment Toolkit for prescribed places in detention. Now, I want to show you the Care Act that backs up the conduct of health needs assessment. Okay, so now you can see, so it's called the Health and Social Care Act 2012. All right. So this act enables local authorities to conduct health needs assessment for to assess the health needs of people in their various communities. So in this essay that is based in US, you can see that the author highlighted the US Affordable Care Act as the legislation backing for the community health needs assessment. So it's important to identify a valid backing, all right, that so that the marginalized population can be protected, all right, so that the needs of the disadvantaged group can be brought to the public and services are tailored to address their needs. All right, so it's very, very important. Now, this essay didn't list she did, I think the author did not list the steps. So, and it's very, very important that before you start your health needs assessment, you need to list the steps, those steps that I showed you in the previous videos. Okay, so I'm assuming that the steps have been listed right now, and then this is where the essay starts from. Okay, so I can see that the author started with what? A review of demographic and health related data, all right, which is what? Scoping or community profiling. All right, so I can see, so here, so I'm going to just make this video very slow. So following existing data from various sources and primary data gathering, they were discussed. Now, the community assets, if you remember when I was saying the community resources, those are the assets. What are the existing structures that the community use to provide services? All right. So, what are the existing structures? So, you need to identify them, whether there are hospitals, how many people are using how many people are using the hospitals. All right. So, let us see how the author developed that. Now, here The author is trying to identify why the specific population. Why is the author interested in this population? And that is the what? The rationale. Why? 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 If you're saying obesity in Bradford, why? If you're saying in alcohol abuse in Kenya, why? All right. So the why answers the question: what is the rationale for your health this assessment? So you can see here that this study population, they are exposed to occupational hazards, all right, and they live in remote geographical locations, and then they face high level of what? Health inequality. So that is why the author chose that population. Now, the next thing you need to state in is your aim, the aim of your essay. So for me, this should be in a clear paragraph so that the marker will not miss it. So the aim of this essay is, then you write out the aim. So you can see here, the aim number one is what? To collaborate. So this is the first aim I'm seeing here. Okay, sorry. So this is aim number one. Evaluate and identify the needs. Okay, that is aim number one. So identify the needs. All right. Then identify the available resources or the assets that are already existing to meet the needs. Okay. So that's the second one. And then to develop an action plan. That's the third one. And then to develop a reporting and evaluation system. That's monitoring and evaluation. So that is the fourth one. All right. So for me, that is enough. Okay. So now, like I told you, you have to identify the resources that are needed. So here, and I'm seeing those resources. So I'll likely put it in a new paragraph. So you can see the resources that the author listed. All right. Those are the stakeholders. All right. And then there was also a budget. A budget. All right. Very, very important. Okay. And then I think there were considerations for meeting venues, all right, and access to the population. They mentioned how the author mentioned how she will assess the population. So this is a very, very important information. So how will you reach the population? All right, and where will you reach the population? So it's very, very important. And then she mentioned other principles of public health like multi-sectoral collaboration. All right, and then gave reasons. That's the critical analysis now. Why this is important. All right, so the author mentioned the power of information sharing. Like if you say multi-sectoral collaboration is very, very important, what are the advantages and what are the disadvantages? That's critical analysis, as simple as that. All right, so you can see here the first advantage is the power of information sharing, but the disadvantage is what? It can be hampered by sentiments. And then what does the author plan to do to mitigate this? A clear understanding of each sector's contribution to the community health assessment is shared. So that means what? To encourage what? Good communication skills, right? Now, so remember, these are the possible challenges. These are the possible challenges that one can experience while trying to conduct a health needs assessment, the possible challenges, and then you list the challenges and then explain how possible you can what mitigate them. Now, communication Okay, so communication will help to what reduce these sentiments and also help in giving a clear understanding. Now, this is the third risk again. The third risk is the risk of access to the relevant, that's to access the target population. All right. So that's the third issue, the third problem identified here. So to avoid this risk, available health observatory data will be explored for possible usefulness. All right. And then the last thing there is what the risk of what misinterpretation of terms across multiple stakeholders. So, and this will be mitigated by developing a common language glossary. So the author attached a sample appendix on the common language glossary. Okay, in appendix one. So, and this is appendix one, common language glossary. Can you see what is health? What is health means? So just a glossary that defines the basic uh, terms. All right. So that's common language glossary. All right. So let's continue. Now, so the second thing is communicate. So now remember we have finished discussing planning and resources, right? So now we move on to, and then remember that by now we have listed the steps in conducting health needs assessments. So now we move on to what's community profiling or scoping. Okay, so here you can make use of the census data. So, and then I'm going to show you how to look at the census data for UK. So you can see here, you describe the community. So you describe the community, the population, how many are they, you know, is there population growth? Then it's also related to your specific population. How many members of Bradford are vegetarians, for example? How many of them have obesity, or how many children have obesity? So you, and then compare it to the national average to see that, okay, you can see now that Alaska has the highest percentage of vegetarian population with 10.7% compared to US average of what 6.9%. So that is a justification to look at Alaska. For example, in Bradford, the percentage of children with obesity is higher, above England average. So that becomes my reason for what writing an essay on health needs assessment for Bradford. So you need to get a justification for your own health needs assessment before you start writing. So you need to do some research. All right. So look at the census data. So these are all about census data. You can describe it in trend. All right. Now another other secondary source. So this is another secondary source of data that can be used. Okay. Now backed up with a US regulation that's called privacy rule. Now, secondary data, like I told you, you have to criticize it. All right. Now you have to choose which type of, are you going to use qualitative data only, or are you going to use quantitative data only, or are you going to use mixed method? That means both quantitative and qualitative. So in this section, the author chose to use a mixed method of data collection. That means both um, quantitative and qualitative approaches. All right. And then also source data from hospital records, from literature, from US Census Bureau, from Behavioral Risk Factor Surveillance System, BRFSS. Also very important that you know that too. All right. And then from other departments databases. All right. So you need to list your data sources, and then you need to criticize your data sources. Criticize it. That is what makes it critical writing. Now, why the strength of some of these data sources lie in their granular disparity analysis, a limitation is what? Lack of what? Up-to-date data on some indicators. Now, how do you plan to minimize this gap? This gap is minimized through gathering of what primary data. So you can see that the author is justifying her method. So her method is not just purely secondary data collection. Let me say, sorry, it's not just desktop based. So she the she what she is sorry she went actually to the field, okay, as if it's primary data. So now, if you're writing up your health needs assessment as an essay or as a presentation, even though you didn't go to the field, you have to write it as if you actually went to the field. So because you're actually being trained to be able to conduct health assessment in real life. So that's why you see this statement here. The gap is minimized through gathering of primary data. And how do you gather primary data? Either through what? Doing a survey, as in questionnaire, or through interviews or focus group discussions. All right. Now, like I told you, you have to highlight inequality. So when you talk about social determinants, you remember inequalities. So now, so now having done that, like that, so here comes to the end. Here from here comes the end of the introduction. Everything that have been said before is introduction and then background. Now we now go straight to the health status of the population, which is the next thing. So remember, you have described the community, then you need to describe their health status. All right. So, and that is the purpose of this section. So here is health status of the population that we're looking at. So if you are talking about obesity or whatever, child obesity, this is where you will now go deep into it. All right. With statistical data to back up why those things are important. So now, the physical health of non-veterans is discussed comparatively. Now, studies reveal that this group of people, they have a higher relative risk of what? Alcohol attributable death. Okay, they have chronic conditions and all that. So you come up with your statistical data to back up what what you are choosing to do. All right. So here is just about literature review, what other studies have said in the past, and just for you to show why that population is important. Can you see that here? Now, I want to highlight something that is very, very important. If you watch, you will see that the author didn't just, even though the title of this remember, even though that the title of this health assessment is looking at mental health needs, you're not going to go straight to the mental health needs. You're going to look at that population, this population here, this American Indian Alaska Native one. What are their general health needs first? How did you know that mental health is the one that you want to write? So that is what you want to show the marker of your paper, or the marker of your presentation. How did you know that mental health needs is very, very important? So now let's look at the essay again. All right. So let's see what the author did here. Let's see what the author did here. Okay. Okay, so sorry. Here we have talked about the community profile. So let's go see what the author did. That should be page 8. Page 8. Good. Page 8, that is the health status. So page 8 answers the question, what is the health status of the population? That's the question we want to answer now. So that we're able to know how mental health now came up. Now, he said studies reveal that this population group, they have higher relative risk of alcohol attributable deaths, all right, compared to the general population, right? So you can see alcohol is here. Now, one third of these adults have multiple chronic conditions, such as what? Are you seeing? Cancer and pneumonia, compared to the general population. Are you seeing that? So I'm seeing cancer here, I'm seeing alcohol. See that? Then I'm seeing cancer and pneumonia. That's their health status. All right. They also have higher level of what? Hypertension at 3.7% compared to the general population, which is with 8.7%. They have higher levels of diabetes compared to the general population. Now, their health is impacted by other social determinants. Apart from having all these diseases, there are other things. So you have to discuss social determinants. What are the social determinants? You use literature. It's not about just listing them. You have to back them up with what? Literature. All right. So you can see other social determinants such as history of colonization, land loss, forced migration. These are social determinants. Now you can look at education. All right, they have similar odds of having bachelor degrees as other Brazilians, but achieving a higher degree is unlikely. So you quote the author to back up your social determinants of health. Okay, it's not just listing it, and don't use one source. Now, Ku et al. Also suggests that the males, so gender, are you seeing? Males have higher burden of diseases and lower socioeconomic states and higher rate of what? Mental health. Are you seeing? Mental health is not coming. Okay. Now, from the multiple studies outlined, it is safe. So you can see how the author now chose one of them. So now, from the multiple studies outlined, it is safe to align with Koofman et al. In asserting that what, relative to the general population, these NVs, that's the population, the study population, they experience poorer physical health and disadvantage socioeconomic status with high impact on their mental health. So these mental health issues are discussed in the next session. Now, this is called what? Good linking. Linking. See? So linking the last paragraph to the next session. So these mental health issues are discussed in the next session. So that's a good linkage. All right. So now we have discussed the general problems of the general health problems along with the social determinants of this population. So now we want to narrow down to mental health. What's going on? All right. The NVs have higher rate of mental health issues. But for me, this would have been at least two or three authors would have been here because it's a strong thing, right? It's a strong claim. Okay. So here you just narrow down what are the mental health challenges that they are having. Okay. So you can see that some of them, the studies reveal that homeless MVs had fewer mental health diagnoses than homeless NHWs. So you now narrow down to what are the mental health statistics to back up that this particular population are having issues. You can see something like post-traumatic stress disorder. It was higher among this population, right, compared to the general population, right? So you just bring in authors. So and then you at the end of the day said to summarize, these non-veterans with mental health issues, they are faced with what? Underfunded resources, culturally inappropriate care, and service access issues. All right. Now, to link to the next paragraph, the next session attempts to assess the leverageable assets. So now, like I told you, you have to discuss what are the assets. That means what are the existing structures that the population normally used to access health before now. All right. Do they have hospitals? What do they have? Mental health facilities? What exactly do they have? So that's what this section is talking about. So based on literature findings, some Alaska, that's people. Some of the populations they have about 55 health facilities. Are you seeing that? They have 1110 international health service units focusing on mental health. So those are the assets. Assets. So you need to identify the assets, all right, of your study population, all right, and NGOs here. So now they listed the author listed a list of the assets, and then also if there are relevant policies, you also list it. All right, and then what are the results from those policies or from all these findings? Here you see that they said that 53% of uninsured non-veterans use. So how many of them are using these mental health services? Only 53%. And so that is a gap. That's a serious problem. So measures of service use, if you remember in the previous video, you can see here that only 53% are using um, IHS services. So that is very, very important. It is worth noting that NVs seek help from traditional healers through other means. Okay, and then the factors that influence their health seeking behavior are what? Low awareness and obtainable services, low awareness of mental health and obtainable services, and then lack of cultural mental health services, and then weak intervention approach. Remember, this is a problem. So you will see that if you are building your intervention, then you can now focus on one of these. All right, like awareness can be how will you improve our awareness through health education? All right. So all right. So now because the author is using both qualitative and quantitative approaches. So that's why there's a paragraph here. But assuming that you're using just secondary approaches, I believe that based on assuming that you're using secondary data alone, then you don't need this section on primary data. All right. So now the author is trying to justify the reason for using primary data. Is in the reason here? Primary data collection. The reason. What's the reason here? What to identify the expressed health needs. So that means like through focus groups. So the author went to the field to collect the primary data, and he did focus groups and in-depth interviews, and then also collected data through semester structured questionnaire to identify the expressed needs. That means the needs that the subject said with their mouths. All right. Okay. So the purpose of that is not just about identifying their perceptions and their thoughts, but also to identify the community members' knowledge gaps. So to identify their knowledge gaps, that is the reason. So this is a justification. All right. Remember that there is also a backing, a quotation to back up. So as you're writing, you need to find authors that to back up your claims, whatever you're saying. All right. And then linked the author linked it to what the four types of needs, which are what express needs, that's what they say, what the subject says. Comparative needs is when you compare that's sorry comparative needs is when you compare the services that two groups of population are using. And then as the normative needs are what expert opinions from health professionals. So this is what a way of linking what you're writing to what you have been taught already in theory. The Brashaw's taxonomy of needs. So you can see how it was linked appropriately. All right. You can also, instead of using this, we can also put the table and then refer to it as an appendix. All right. Okay. So you can see when I say critical appraisal of your data sources, so surveys are anonymized to prevent social disability bias. If I'm to mark this, there needs to be a reference here. There needs to be a reference here. All right. Okay. So, all right. So let's go. Now, like I told you prior, so your essay must prioritize you need to describe how you prioritize the health needs. So here the author is trying to describe how she prioritized the health needs. So after collecting both primary and secondary data, they are merged together using triangulation method, and then the list of health problems are produced. On a normal day, I'm supposed to link it to an appendix, list the major health issues that were identified in this section, right? And then rate them against four criteria. So this is the four criteria that were used, all right? The impact, severity, and magnitude. Then changeability, right? And then impact, acceptability, and then resource feasibility. So these are similar to what I have listed again in my own slide. So these are just in other words. Okay. So there is no just one criteria for assessing your for um, assessing the priority of the program that you want to implement. All right. So I think at this point I want to show you something here. Okay. So from gov.uk website, where is it now? The prioritization matrix. Okay, so if you're trying to prioritize, I'll drop this link um, in the PowerPoint too. I'll attach it to the into the PowerPoint of the first video. So there are strategies that you can use to do your uh, to prioritize the needs. So now these are the how to determine your needs. So this is gov.uk website. I think the title of this page, you can Google it, is Population Health Needs Assessments, a guide for 0 to 19 health visiting and school nursing services. So if you type in this in Google, you'll get this to this page. Now you need to read it so that you see how you can prioritize it using points, a point-based system. Okay. So if you look at this one here, I want to scroll down to to here exactly. So this is a matrix, the impact, changeability, acceptability, and feasibility matrix. Okay, so now in this matrix, they are all scored together. So if you divide this into four places and then you give them score based on 1 to 5, all right. So the one with the top two with the highest score, or the first one with the highest score, you can say, okay, based on this score system, this is this is what I want to address. This is what my intervention will be focused on. So by the time you look at the impact, is it low, moderate, or severe? Sorry, 1 to 3. Sorry, low, moderate, severe. All right. Changeability. How realistic the chance of achieving the change? Is it something that you can achieve? You rate it again. 1, 2, 3. Acceptability. Are there acceptable solutions available? 1, 2, 3. Then is it feasible? Do you have enough resources to execute it? You rate it 1, 2, 3, and then the one with the highest score goes. So that one becomes the one that you will what choose. All right. So there are other strategies here that you can read up. You can read up this one is if you are doing a primary research, so you can read up. So that's why I prefer doing a secondary research for health needs assessment as a student because of time. So you also have priority grid. If you download the example here, you can just download it as a template and then you will see what it looks like. Then you have the nominal group technique. Assuming that you are doing a focus group discussion, you identify the needs and then you bring it back to the community members and then they can now vote. All right. And then you rank their votes, and then the one with the highest number of votes becomes the one that you can becomes the intervention that you will do what engage in. So these are the various ways of doing your prior that's of identifying the priority need that you will intervene in. Okay, so let me see whether I can have a look at the template here. So just choose one template, don't mix it, just choose one, the one that favors you. Okay, so you can see here I'm seeing priority grid. So you can see, does the issue affect multiple people? So this is 1 to 5 here. So now these are the issues that someone had identified, three issues, all right? Now, but the person wants to now choose one, at least the best, or two to address. So does the issue affect many people? You feel 1 to 5. Does it have a severe impact? Is it a national, local, does it have national or local priority? All right. Is it something that you can do? Is it feasible? So you rate it there and you add up the scores. The one with the highest score becomes what the one you choose, the top two. All right. So I think this is good. I like this. You can use this one as your template for your studies, and then that will reduce all the English I've been speaking here. Okay. All right. So you can choose other frameworks if you like. You can see Halon's pair. I don't know that, but then you can choose that if that's okay with you. All right. So now you need to demonstrate how the program that you are the intervention you're planning aligns with the government priorities. So you can see here that this access that's these are the priority mental health issues. So the access to mental so so your essay must highlight two, at least two, or let's say one or two. By the time you have done your health needs assessment, you need to come up, and then you have done your prioritization matrix, and you have gotten the top two or one. You can now say, okay, this is the one I want. So from this essay, I can see that the author chose access to mental health services and suicide prevention programs as the priority issues. Now you need to show how these things are linked to national or local priorities. So you can see that here the author backed it up with what it's that okay, she said that the alcohol misuse and homelessness, they are not prioritized because of the burden of disease, so they are less severe. You understand? All right. So now it's also aligned with the Mental Health Parity and Equity Act and then Sustainable Development Goal. Right. So the program that so you can see that access to mental health services and suicide prevention programs is aligned to these government priorities. All right. So it's very, very important. All right. So here is talking about equity. I don't think I have anything here. All right. So now, so you need to write up the intervention. What intervention do you want to undertake? Now, in design and intervention, you need to make sure it is equitable. All right, and then that it also goes to those that really, really need it. All right. So I think that's what the author is writing here about horizontal and vertical equity. So you need to read it up and see how you can apply it in your essay. Now, the author stated the aim of the intervention is to reduce health inequalities by removing barriers and ensure sustainable equity access to mental health services and to reduce suicide mortality rates. All right. And also to ensure cultural relevance, it is essential to develop cultural adaptable strategies. So the author didn't say an example, okay, but then okay, let me see. Okay, I'm seeing an example here. A family wishes for privacy. Okay, a family wishes for privacy over a patient's health. Okay, healthcare providers behave differently towards members of minority if they are afraid of being perceived as racist. So the author further echoes that in delivering services to people from other cultures, professionals must tread a fine line between cultural blindness and cultural deficit in trying to provide culturally sensitive care. All right, I like the example. So the author just aligned with what with Webb et al. Said. All right. And then also, um, okay, yeah, I think basically. So this example is from Web et al. So if you don't have your own example, you can also state, give an example from what a different author said, and then align and say that you agree strongly with this. Okay. Okay. So now, what are the interventions that you are proposing? All right. So here, the author is proposing a review of the mental health parity legislation and development of culturally sensitive psychological therapies. Okay, and then advocating for recruitment of mental health service staff. All right, who reflect the diversity of the population. So the author listed three things, three strategies here for mental health. Okay, and then for suicide prevention, the author proposed uh, restricting access to lethal means and then also encouraging help-seeking behaviors. So this will be achieved through collaboration with mental health providers, increasing public health awareness, and stigma reduction campaigns. Okay, so you can use a narrative to explain what you want to do, or you can also use the table that I showed you in the previous video. All right, so think, and then the author talked about indicators. Indicators. How will you measure the results of your study? So you can see here by measuring number of people that access mental health services, okay, number of people that miss appointments, by measuring the wait time, all right, or by measuring the cost of providing mental health services, all right. So I think we have done justice to this essay. So, and then the last stage is what monitoring and evaluation. So I've already described this in your that's in the video that I did before. All right. So I think this essay is fairly good, and then this is the conclusion. All right. So I think with this we come to the end of this session. So I've listed I've listed for you some tools that you can use. If you click on any of these links on, I think they are these links are in the PowerPoint. You'll be able to see how to access some data sets, some statistical data, so that you'll be able to retrieve data for your um as for your health needs assessments. All right. So I think I'm going to come to the end of this session. So try and check out these links here and click on them, explore them, and then you see how you can just search for your topic. When you get to these websites, go to the search bar, enter in your topic, you will see some uh, statistics, data, some records. So try and retrieve them, and then let's see if you have any challenges. I'm here to help you. So thank you for coming to the end of this video, and God bless you.